Good morning. It is Thursday, June 11th, 2026. We are streaming live spine surgery out of Deuk Spine Institute's operating rooms. Our patient travels here from Louisiana, the beautiful state of Louisiana. And she's here because she has pain in the middle of her thoracic spine. Most commonly, people get pain in their lower back when they have spine pain, usually lumbar. Second most common place is cervical, their neck. But it's uncommon to get a thoracic pain and a thoracic disc herniation, but she has it. So we got to start. We know it's at T8-T9. She has a T8-T9 disc herniation. It's centrally located, so we're going to go on both sides to get to it. We're going to go right and left, bilateral, T8-T9 Deuk laser disc repair. This is the procedure that we do. It's minimally invasive, and it's done to treat and eliminate discogenic back pain. Now, we normally would do a discogram with the patient awake to verify pain is coming from the disc we're operating on, but she doesn't want to be awake for the discogram, so we shall respect her right to not be awake. We're going to keep her asleep, but we'll still do the discogram because we need to see the herniation. All right, I need to verify we have 12 ribs so that I'm going to start counting. Let's show T1. Can you see the x-ray? Go to the other side. T1, that's the T1 pedicle. Good job, Jordan. T2, 3, 4, 5, 6, 7, 8, 9. So she's T8-9, correct? Yes, T8-9, you agree? All right, looks like just to the other side of that, there's something in her lung right there. You guys see that? So that's right at the T8 vertebral body. Wouldn't you agree? Yes?
Yeah,
all
we
right.
see that.
Sean? All right, so that's T8-9, and that's exactly where her pain is. She pointed that out to me before surgery, and that's where it is. Go ahead and move south, just a little bit. Stop. T8-9, 10, 11, and 12. So keep going just a little bit more. Stop. And there it is. 8, 9, 9, 10, 10, 11. Let's see, 8, 9. That's 9, 10, 11. We need to go down one more. 12. All right. Dr. Berndes, what are those things in the lungs? Just bronchi? Calcified? Calcified bronchi? Probably. All right, let's go down a little bit more with the fluoro, just another inch. We want to count upwards now, just to make sure we're at the right spot. So there's L1. You're on the x-ray, Anthony. L1, 12.
Yes, I am.
11, 10, 9, 8. What's that? No, there's all that. Show them the calcified bronchi. Look at all that stuff. You see that? There's probably calcified bronchi. All right, so we're in the right spot. We're going to go bilateral. And you can move up just a little bit. North, stop. I want to see 12. Keep going. Shot. Keep going. Shot. All right, so there's 12, 11, 10, 9, 8. So I'm still at 8, 9. Shot. All right, it's looking good. We're going to be checking this several times throughout the surgery. You got to make sure you get the right level. I'm going to do my very best. I expect to get to the right level. All right, 8, 9 shot. Let's go with a lateral view. So the first thing we're going to do laser spine surgery and fix this woman's thoracic pain at T8-9, I have to get into the T8-9 annular tear. Now the annular tear at T8-9, Luis, please, is in the back of the disc, and that's where her pain is coming from, T8-9 annular tear. So I'm going to make my way down there. Shot. Shot. That should be the facet. Shot. Shot. Alright, got to get around the facet joint, actually in the transverse process. Just stay there for a second. Now, let me think. Need to be just a little bit more lateral. Perhaps a little superior. There we go, shot. Shot. AP, probably need to be a little bit lower. This is truly the hardest part of the surgery. 12, 11, 10, 9, 8. It looks like 8, 9. Good. So I've got to make my way medially, shot, towards that disc. Shot. Shot. A lot of arthritis. Shot. Shot. Let's get an AP view. She's got some scoliosis. That's actually pushing my needle laterally. Lateral view. No, it's not where I want to be. I have to redo this. I'm going to have to start a little bit higher, probably. Let me see here. There's the transverse process. Let's go just a little bit higher. Shot. 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 AP, again I'm hitting that same spot. I may have to start even a little bit higher. It's looking a little bit better, but I'm still hitting bone. And that is the transverse process, just the top of it. Let's see if I can get around it. Shot. Now people may ask me, what is the hardest surgery you do? This is it. Okay, there's no doubt about it. Thoracic, endoscopic is the hardest. Shot. Shot. Any questions? Shot.
No questions.
Shot. All right, give me an AP. So we're heading towards the disc. We still got a little ways to go. That looks really good. I'm very happy with that. Let's show the audience while I finish getting into the disc, while they're waiting for me to do this. Let's show them how thoracic disc herniations we don't have a 30 causes of thoracic pain, but let's show them a 30 causes of back pain. Let's do that. Let's start. I'm Dr. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. Welcome back. You can see from our animation that the most common cause of back pain is herniated disc. That's what she has. There are many different names for herniated discs. They're all the same. Herniated disc, bulging disc, ruptured disc, protruded disc, extruded disc, slipped disc, burst disc, degenerated disc, spondylitic disc. All of them are the same thing. They all cause symptoms exactly the same way. It is inflammation in the back of the disc, specifically where there's a tear. Now, I was able to get our needles in on both sides, so we're inside the disc at the tip of the needle. We're specifically inside the tear. Now, I'm going to bring a dilator down. You guys see this dilator? It's metal. It's going to slide down the guide wire. This is the guide wire. I'm going to spread the tissues with the tip. There's no cutting at all. We're not removing bone. We're not removing ligament. We're not removing the disc. We're not removing anything normal around her spine. We're merely spreading the tissues open, doing the laser on the herniation, and coming out. When we come out, all the tissues go back to normal. The only thing that's cut is the skin. That's it. So there's really no bleeding. We've lost basically 3 drops of blood the whole surgery. There they are. And we're going to do the entire surgery with virtually no blood loss. Our anesthesiologist is going to keep the blood pressure under 110 systolic, right? So that I can do the surgery. Good. All right, shot. Now, if we look at the x-ray, you're going to see the dilator working its way down to the disc. The disc we're repairing is T8-9. She has a herniated disc at T8-9. That was diagnosed on MRI where she lives, where she comes from, Louisiana. We did a virtual consultation with Zoom. I verified that T8-9 was indeed the cause of her pain, the herniation at T8-9, and I offered her our treatment, the Deuk laser disc repair, which you're watching right now. So she came here with her husband to have this surgery done. Put something here. Any questions?
No questions.
Okay, so what is the success rate of this surgery? People are asking. The success rate is 99% of the pain will go away. That's the average, 99%. So if you have back pain from a disc problem, and we do the laser here at Deuk Spine Institute, this laser surgery, we can get rid of 99%. The actual number is 99.6. So it rounds up to 100% of your pain will go away permanently with this treatment. That pain, of course, is the pain that comes from the disc we're operating on. Some patients end up having a second cause of their pain. So they have to come back and get the second cause or third cause fixed. But we can only diagnose pain if you tell us where it comes from. If you don't point out the pain, we can't fix it. So to fix back and neck pain, we must know where it's coming from. If you don't have it the day that we're examining you, we can't tell you where it's coming from. In her case, she could. She told us the pain's right there. And that happens to be right where T8-9 is. She's laying on her belly. She is sleeping with twilight sedation. We don't use general anesthesia for this. We're going to fix this disc in 10 minutes. We'll do the other one in 10 minutes. And then she's going to be taken back to the recovery room. It takes 1 hour of recovery, and then she goes home. In her case, she'll go to the hotel with her husband, and we'll see her tomorrow morning for a quick checkup. I would expect the pain to be completely gone by tomorrow. Any questions from our audience?
No questions.
All right, take a look at that little glass fiber at 12 o'clock. You guys see that?
Yes, we do.
That glass fiber transmits laser energy from the machine, which is at the feet of the patient right here in the operating room. Looks like a big suitcase. The laser machine is manufactured in Israel by a company called Luminous. They are the best laser manufacturers for medical purposes. The machine is FDA approved for use in healthcare, in medicine. And this particular laser fiber is FDA approved for use in the disc, in the spine, specifically the disc, which is what we're using it for. So, here she is getting her thoracic herniation fixed. What can I tell you? This is inside the tear. This stuff I'm using the laser on is herniation. You can see a few pieces like that one right there. That is a piece of herniation that is scarred and calcified. Why is that important? Well, you don't get scar tissue inside the annulus unless there's chronic inflammation. You must have chronic inflammation to get scar tissue. So the fact that there is this scar tissue and this calcified herniation tells me It's been here a long time. This has been going on for a long time, and it's inflammation that's happening. Well, we know that inflammation is the cause of pain in the human body. All pain comes from inflammation. Remember that. All pain comes from inflammation, which is why anti-inflammatory medicines are so popular, over-the-counter, like ibuprofen, Motrin, Aleve, Naproxen, BC powder in the South, Goodies powder. Okay, all of those anti-inflammatory medications work on inflammation. So people get a little bit of relief when they take the medicine, but unfortunately, they're not actually fixing the problem. To fix the problem, they have to come here to Deuk Spine and get our laser surgery. Just like this lady came from Louisiana to have her laser spine surgery done here at Deuk Spine Institute. Let's show the audience how herniated discs, the number one cause of pain in the spine, how they cause so much pain.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. I'm sorry the video didn't have any voice. Anthony is going to get that fixed. He's going to send the video to Henry, and Henry will add the voiceover. But basically what the video was saying, or should have been saying, is trauma or traumatic injuries to your spine cause an annular tear, a tear in the ligament that holds the bones together, which is what the annulus fibrosus is. It's a circular ligament because the bones it holds together, they're circular. Okay? So the annulus fibrosus, it means ring, fibrous ring, is basically a ligament holding the bones together. The bone above and the bone below, called the vertebral body. So you got this ring-like ligament holding the bones together, and when you have an accident like a football injury or a car accident, slip and fall, the force overwhelms the ligament holding those bones together, causing it to rip. So the ligament rips. Okay? Fracture of the bone doesn't happen, you get a fracture of the ligament. And when the ligament fractures, it can fracture in the front, the sides, or the back. When it fractures in the front or sides, you may get a herniation in the front or side of your disc, but it doesn't cause any symptoms. Only herniations in the back of the disc cause back pain, or neck pain, or thoracic pain, in this case. All right, let's show the audience how we use the endoscope and laser to repair, through debridement, the annular tear. This is a procedure that I pioneered here at Deuk Spine Institute 20 years ago. We've been doing this surgery for 20 years, and we've done now, Anthony, 2,774. This is number 74. So 2,774 surgeries here at Deuk Spine of laser spine surgery, endoscopic laser spine surgery, like we're doing right now on this patient. And the success rate is 99% elimination of pain. That's our success rate of eliminating back pain, neck pain, thoracic pain when we do this surgery. Of course, the pain we're talking about is disc pain. We're not talking about facet pain or any other type of pain, just disc pain. Let's show the audience how this surgery works.
Disc injuries are a common cause of chronic thoracic back pain. The inflamed annular tear causes thoracic back pain. 1/4-inch size skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The advantages with the Deuk laser disc repair is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, you've seen now through our video how we use an endoscope to see inside the disc, and specifically what we're looking at is the tear in the back of the disc. This tear is responsible for all the pain that patients get when they have a torn disc or herniated disc bulge. When the pain comes from the disc, it comes from a tear in the back. That's what I discovered here at Deuk Spine Institute 20 years ago. And we've been published multiple times. As a matter of fact, peer-reviewed and published over 10 times, and presented this surgery to meetings, national meetings, international meetings of spine surgeons, pain management doctors for the last 16 years. And this is the best treatment in the world when you have a herniated disc that causes pain. Okay? It's the safest. We've not had a single surgical complication. It doesn't cause any adjacent segment disease, so you're not going to get problems with the discs or joints above or below the surgery in the future like you do when you have invasive surgery. Invasive surgeries such as laminectomy, discectomy, fusion, artificial disc replacement, they all end up causing problems for patients that patients have to go back and have more treatments for, like pain management or MRIs or more fusion surgery. Look at that piece of herniation there. You guys see that? That came from the center where the biggest part of the herniation is. All right. So one of the reasons we do the surgery is because it works. It gets rid of basically 100% of the pain from this disc. The second reason we do the surgery is because we've not had a complication that's safe for the patients. Complications are problems patients get, like infection, nerve damage, spinal fluid leak, pneumothorax, pneumonia, heart attack, stroke. The list goes on and on and on. And when you do invasive spine surgery such as laminectomy, discectomy, fusion, disc replacements, all of those invasive surgeries, they cause complications. But not the Deuk laser disc repair, which is only available at Deuk Spine Institute today. Someday we're going to have our centers all over the world where patients can go locally and get it done. But today there's only one, and it's right here in Brevard County. So you got to come to Florida to get this done. We're planning to open a center in Orlando, and then we'll open a center in California next. Who's going to go work in the California center? Luis? Yes?
We're gonna try. How are you gonna get there? Like a weekly?
Huh? What?
I mean, maybe Arias is gonna be there.
Oh, yeah, we're going to have more doctors. We're going to have more surgeons. So I have to train more doctors. That's how it's going to happen. Do we have any questions from the audience, by the way?
Yes, we do. We have a question from AJ on YouTube.
Hi, AJ, welcome.
Hi,
Sure.
you are really great. Can you orient us as to the cranial, costal, medial, and lateral in
Yeah, of course.
endoscopic view?
Yeah, so 12 o'clock right there, 12 o'clock where the laser fiber is medial. That's where the spinal cord is. The spinal cord is on the other side of this metal tube at 12 o'clock. On the left at 9 o'clock is cranial. That's where the head is. And at 3 o'clock is caudal. That's where the legs are. So, and then of course at 6 o'clock is where I'm standing, and that is lateral. So medial, lateral, that is the end plate of T9, superior end plate of T9. You're looking at right there, all that surface is the end plate of T9 on the right there at 3 o'clock. And of course you have the end plate of T8, which is the inferior end plate of T8 is on the left side. And I'm just getting rid of the last bit of herniations here that we need to get rid of. Look at all that calcification. The gold color is calcium. When the laser energy hits the gold, hits the calcium, it turns it into a gold color. So the spinal cord and epidural fat at 12 o'clock. We've got lateral where the nerve root is at 6 o'clock, and we're just about done. There's the outer fibers of the annulus. Got a little bit of foraminal ligament right there at 12 o'clock. You got pieces of herniation coming out. Remember, the laser fiber itself is just 0.45 millimeters, so it's about half a millimeter, just to give you a reference of scale. All right, just about done. Just getting the last few pieces of herniation, but we're now at the outside of the disc right here, looking at the last bit of bone spurs. These are bone spurs, and I'm getting rid of them. I'm going to flip and go lateral, and we'll be done. Any other questions?
Yes, we have a question from Lanu on YouTube.
Hi, Lanu, welcome.
Does the laser use up a lot of electricity? And what's your electricity bill?
Lanu, great question. The laser does use a lot of electricity. It's the most electrical consuming equipment we have in the operating room. It uses 220. It's the only piece of equipment using 220. The electrical bill would shock you. Our electric bill is $12,000 a month. It's ridiculous. Everything is so expensive in healthcare. It's why the cost of healthcare is so high. I got so many bills to pay, but 12,000 US dollars per month for a 20,000 square foot building. All right, we're done. Let me show you guys the endoscopic rig. Take a look. Can you see this, Anthony? Go to the eye in the sky.
Yes, I can see it.
All right, we got the camera, the scope, irrigation, laser fiber, and of course the light source. Okay, we put this down the tube. It's a 4 millimeter tube. 4 millimeters is the outer diameter. That means the inner diameter is 2.8 millimeters. So everything is done with 2.8 millimeters of room. Isn't that amazing? 2.8 millimeters. I mean, just think about that. This is the most advanced, sophisticated spine surgery available in the world today. That looks good. We'll get those 2 staples out tomorrow when she comes in for her checkup. Any questions?
Yes, we have a question from Kayo on YouTube.
Hi, Kayo. Welcome.
Hello, doctor. What type of IV medication do you currently use for twilight sedation? Is it propofol, and what's the dosage?
That's a great question, Kayo. So I'll have our anesthesiologist, Dr. Berndes, field that one.
So she gets propofol on an infusion pump.
She gets propofol through an infusion pump.
Currently, she is on about 65 to 75 micrograms per kilogram per minute.
She's on 65 to 75 micrograms per kilogram per minute currently.
With a fentanyl and Versed up front at the beginning of the procedure.
She gets a little fentanyl and Versed up front at the beginning of the procedure. We give small doses of fentanyl as needed during the operation. All right. Fentanyl, as many of you know, is a opioid pain medication. It blocks the opioid receptors so people don't get pain. Propofol just puts you to sleep. It doesn't have any pain effect. It does not reduce pain at all. And Versed is so you don't remember. It's an amnestic agent, so you don't remember what happens in the operating room in case you accidentally wake up, which our patients don't wake up, but if they do, we make sure they don't remember anything bad, right? Can you hold that? Is that where I'm at?
Yes, sir.
All right, we're going on the other side now at T8-9. Hold on. So hold on, let me just see. Okay, good. I'm gonna, remember, get this, I gotta get this piece of herniation from both sides because it's more central. So if I just do one side, I may leave half of it on the other side and then she may still have pain. So I wanna make sure I get both sides. Any other questions?
No questions?
All right, just tell me when.
Yes.
Nope. Put the, any other, no questions. All right, so let's do this. We've shown the audience the 30 causes of back pain. We've shown them how a disc injury causes back pain. Ready? And we show them how we use the laser to go in and repair a thoracic disc herniation. Correct?
Yes.
So at this point, we've got one more side of this disc to fix. And then we're going to wake her up. And you guys can see how small the incision is. It's just 4 millimeters. Do you have a tape measure? Look at this here, Anthony. Let me have it. Can you see this?
Yes, I can.
4 millimeters. Here's sonometers. It's just a 4 millimeter incision. Again, this was the procedure that I developed here at Deuk Spine. I pioneered this entire thing. And I was the first in the world to do thoracic, transforaminal, endoscopic Deuk laser disc repair. I think my first patient was about 10 years ago. We published our results. We had 99% elimination of thoracic pain 1 year after surgery. So it lasts. It works. It lasts. I was just talking to a patient of mine in South Africa. He's a doctor. I just saw him yesterday. He had our laser surgery done 6 months ago on the thoracic spine. He had 2 thoracic discs repaired, and now he has facet joint pain. He doesn't have disc pain anymore, he has facet pain. So I offered him to come back and get his facets treated. He's gonna try to get back out here to get it done. So it just highlights that there's really 2 sources of chronic pain in the spine that are common in the thoracic spine. One is the disc, which accounts for 90% of people's pain. And the other one is the facet joints, which account for about 10%, maybe 12% of the pain. So if you fix just the disc, your patient's still going to have facet pain, if they have facet pain. But many people don't have facet pain. They just have disc pain. So we fix their disc, and they don't get facet pain. But I think probably about half the patients also have facet pain. So it may be a thing in the future where we just do both the disc and the facet. Because having somebody have to travel back to Florida from across the world is not good in anyone's book. I'd rather get everything treated. But we don't do treatments unless people have the symptoms. So sort of preemptively treating people with surgery is not a good idea. Sort of somewhat of a slippery slope. You don't want to do too much because every time you do something, you run the risk of hurting the patient, giving them a complication. So you want to be very judicious in what you recommend and do for people surgically. All right, you can see the pieces of herniation, like that one right there. Still stuck with scar tissue. I'm trying to get rid of it. There it goes. Any other questions?
Yes, we have 2 questions from Kayo on YouTube.
Let me have the grabber.
The first one is, would this work this would work good for a ruptured disc in the annulus, but will it also work for a ruptured disc that protrudes into the spinal canal?
Yeah. Great question, Kayo. Sounds like we got a bunch of doctors today watching. The answer is yes, it can still treat a ruptured disc with a fragment of herniation in the spinal canal, pushing on the spinal cord. I've done that before. I had a boy who came here, he was 13 years old. He was paralyzed basically in a wheelchair. He's from Seattle, Washington. His mom brought him because in Seattle, they just ignored him and thought he was faking his symptoms, that he didn't have strength in his legs. He was losing control of his bladder. So I did an MRI review. I saw a gigantic herniation at T10-11, and I did my thoracic T10-11 Deuk laser disc repair. And she sent me a picture of him 1 year later. He was playing basketball in the basketball gym, running up and down, jumping, but he was in a wheelchair when he came to me because his spinal cord was compressed through a large extruded fragment. So the answer is yes, we can definitely treat herniations that are not just contained within the annular tear. We call those interposed, nucleus herniation, interposed. But we can also successfully treat herniations that are extruded out into the epidural space. Good question.
We had a staff member who was in a wheelchair and I saw walking.
Oh yeah. Well, that was a lumbar. So we had one of our staff, I can't give you her name, but she had this surgery done. And prior to the surgery, she couldn't move her entire leg. And she had no feeling in her leg at all. And now she's back walking. She was in a wheelchair, and she's now walking and wants to come back to work. So this surgery is amazing. It will replace, in my opinion, 95% of spine surgery being done today. The microdiscectomies will no longer be done. Laminectomies will no longer be done. Artificial discs will no longer be done. Fusions will only be done for fracture dislocations and tumors and severe infections like tuberculosis, where there's deformity and instability. But 95% of spine surgery will go away, and surgeons will only do my surgery that I developed because it's that much better. The problem is it doesn't pay the surgeon much money. Surgeons get paid very little to do the surgery, almost nothing. So they're not going to recommend it to their patients if they don't get paid anything. That's the problem in America today, is that all these doctors are going to lose a lot of money if they recommend this surgery. They're going to basically probably have to go out of business. So will the hospitals. So we have a broken system that rewards people for doing invasive surgeries on patients that don't work. And the patients keep coming back getting more surgery. So we got to fix our healthcare system in order for this procedure to become widespread. It will never be widespread, ever, because it doesn't matter what the patients want. It matters what the surgeons want. And that's a problem. Right, Dr. Berndes? That's a problem. The surgeons will not do surgery that they don't want to do. It's just the way it is. So we've got to disincentivize surgeons and re-incentivize them to do what's best for the patient. If we can do that, then we can fix the system that's broken.
Or train them on a better technique, more effective.
Yeah. Look at that piece of herniation right there. I'm going to go in and try to grab it out. It's just too big.
This was taught in residency programs right off the bat before we do it.
Yeah, if residents were taught how to, oh, there it is. You guys see the piece of herniation here? Anthony, take a look right there.
Yes, we do.
Hey, it doesn't look that big, but remember, thoracic herniations are not that big. Can you see it right there?
Yes, we do.
That's one of many pieces that I've taken out. Remember, this is important. Don't think of a herniation as being one piece. Think of it as being like a bag of marbles. I got 5 minutes. Like a bag of marbles. Okay? The bag can be very big. The marble itself is small, but a bag of marbles can be really big and really hard. You wouldn't want to get hit in the head by somebody with a bag of marbles, right, Luis? You wouldn't want to be hit in your marble by a bag of marbles, because each piece is small. It can't do anything by itself. But when you add them all together in a bag, which is what a herniation is, it's like 30 marbles, then they have mass, and they can compress on things like nerves or spinal cords and cause some damage, which is what we're dealing with. Great questions. Any other questions?
Yes, we have a question from Michael on YouTube.
Hi, Michael. Welcome.
Hi, Dr. Deuk. I'm grateful for your time.
Yes.
Do you have an opinion on endoscopic laminectomies?
Hold on. On endoscopic what? For amyotomy?
No, laminectomies?
Laminectomy?
Yeah, laminectomies.
Sure. Okay, keep going. I heard the question, that part.
How do they compare to traditional laminectomies? Are endoscopic laminectomies performed at your facility?
Yeah. Great question. So the question is, Dr. Deuk, laminectomy. Surgery, it's been around for a long time. Here's the deal. Laminectomy is a bad surgery. Therefore, we don't do it here anymore. We used to do it all the time. I did one last week, cervical. Hey, why is laminectomy bad? First of all, laminectomy was developed over 100 years ago, spinal laminectomy, by a neurosurgeon who did it because he was trying to treat a tumor in the spine. Okay? His name was Victor Horsley, Dr. Horsley. He's a neurosurgeon over 100 years ago. Dr. Horsley did a laminectomy so he could take a tumor out. That was the first laminectomy that was done. But it should have been the last. The problem is laminectomy is a necessary treatment when you have a tumor or if you have a blood clot pushing on your spinal cord or nerves. You must do a laminectomy to get rid of the blood clot and restore function to the patient. But laminectomies have been overprescribed by doctors. And now we're doing maybe 500,000 laminectomies a year in the United States when we should be doing maybe 100 laminectomies a year, in my opinion. There's a much better treatment than laminectomy, and that is what I'm doing today, the Deuk laser disc repair. There is no need to do laminectomy for spinal stenosis when you have this surgery. This surgery eliminates laminectomies. It has better results, and it's safer for the patient. It does not create instability. Laminectomy procedure, the surgeon has to remove all the bones and ligaments that hold your spine together. These are normal bones. Lamina, just the name of the procedure, laminectomy. Ectomy means to remove from your body. Lamina is the lamina. It's a piece of bone you're removing. Okay? When the surgeon removes the lamina, they're removing it from your body permanently. So what is the lamina? The lamina is a normal part of your spine. So you should be asking yourself, why does the surgeon want to take out a normal, 3 minutes? Why does the surgeon want to take out a normal part of my spine? And the answer is because in the old days, that's all we had to treat spinal stenosis. We had laminectomy, nothing else. But now, in 2026 and 2025, for the last 25 years, we've had endoscopic Deuk laser disc repair, right? So there's no reason to do laminectomy anymore. There's no reason. It's dangerous for the patient, unnecessarily dangerous. It's dangerous, period. And now it's unnecessarily dangerous. Why? Because we have better treatments. So why do a laminectomy treatment on a patient, which is dangerous for the patient? There's lots of complications. And it also creates instability because you're removing normal parts of the spine, like the lamina. The surgeons frequently remove the facets or parts of it. They remove the lamina. They remove the interspinous ligament, the supraspinous ligament, and the ligamentum flavum. All normal, shouldn't be removed. They're being removed. Why? Because the surgeons don't know how to do anything other than laminectomy. Well, I'm sorry, but a surgeon's ignorance should not be the reason you get a bad surgery. Okay? Go out and find a better surgeon to do your surgery. So, do I agree with endoscopic laminectomy? Absolutely not. Is it a good procedure? Absolutely not. Should it be abandoned by doctors? 100%. In my opinion, it should be abandoned. So that begs the obvious question. Dr. Deukmedjian, you're saying abandon all these surgeries that we do today on patients, millions a year, and replace them with your laser surgery, right? Yes. Well, how are we going to be able to treat the patients with your surgery if we don't know how to do it? That's right, you don't. Are we out of irrigation? So the world has to change. I don't have all the answers, but I know that those surgeries like your laminectomy shouldn't be done anymore, period. Okay? There are very rare exceptions. Very rare exceptions. Any other questions?
Yes, we have a question from Michael on YouTube.
Yes, Michael.
Does a disc have to be herniated to
30
receive
seconds.
laser treatment?
I'm sorry? Does what?
Does a disc have to be herniated to receive laser treatment, or is there a instance of a bulging disc that would receive laser treatment?
Yeah, Michael, great question. A bulging disc is a herniated disc, just so you know. Okay, there's a bit of misinformation out there about definitions. The fact is, herniation means when one part of your body moves into another. It moves out of place into another. A disc bulge is the nucleus pulposus that has moved out of the nucleus and into the annular tear. Therefore, it is the migration of nuclear tissue into annular tissue. It is by definition a herniation. Okay? That is what a herniation is. But like I said in the beginning of the surgery, there are 10 different names for the same damn thing. 10 names for the same thing. All right, we're done. A little bit of fat right there. The spinal cord is literally at 12 o'clock. Right there, okay? That's the lateral border. There's a nerve root right there. There's the axilla. But we're done. Everything went perfect for her. The anesthesiologist did a great job. He's waking her up. We're finished at T8-9. Thanks for watching. You guys are watching the most difficult endoscopic transforaminal surgery that can be done in the world, which is thoracic. And we just completed it in under an hour. And she's going to go home in about 1 hour. Great job, team. Audience with why the Deuk laser disc repair is better than laminectomy, discectomy, fusion, disc replacement, and all the other treatments that are being recommended. Hi, I'm Dr. Deukmedjian. We've just completed our free MRI review at Duke Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint, or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Duke Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Duke Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening.